All right, let's dive into a really fascinating research method, one that's all about understanding people from the inside out, especially when it comes to the world of nursing.
It all really starts with this one big question. In a clinic, we can track vitals, we can run tests, we can listen to all the symptoms, but how do we really see the full picture? How do we get a sense of the cultural and social worlds that shape a person's health choices long before they even walk through our doors?
Okay, so here's our game plan. First, we're going to unpack what ethnography actually is. Then we'll look at the tools researchers use. After that, we'll connect it all directly to nursing. And finally, we'll get real about the challenges and the incredible impact it can have.
So let's get right into it. What in the world are we talking about when we use the word ethnography?
Well, at its very core, the name kind of says it all. Ethnography literally means a portrait of people. It's a way of doing research that's designed to describe and understand a group of people, a culture, totally from their point of view.
And here's the big idea behind it all. The whole thing rests on this one assumption, that every group of people develops its own unique culture. And we're not just talking about food and holidays. This culture is like a lens that shapes how people see absolutely everything, how they experience the world, what they think about health, about sickness, and even who they trust when it comes to medicine.
And this right here, this is so important to grasp. To really paint that portrait, the whole goal is to capture what's called the Emic View. That's the insider's perspective. It's about seeing the world the way the people living in it actually do. It's the total opposite of the etic view, which is just an outsider looking in and interpreting things. Ethnography wants to be in the room, not just peeking through the window.
So, how do researchers even begin to get that insider view? What does their toolkit look like? Well, it's probably not what you're picturing.
Get this. In ethnographic research, there are no sterile labs, no clipboards with endless surveys. The main research tool is the researcher themselves. They literally become part of the community, living and participating in the daily flow of life, sometimes for months or even years at a time.
And while they're there, living in this community, they're on the lookout for three big things. First, cultural behavior. What are people actually doing, day in and day out? Second, cultural artifacts. What things do they make? What do they use? And third, cultural speech. What do they say? And just as important, what do they mean when they say it?
So how do they gather all this information? Well, it's through being there, participating, and just observing. It's through having long, deep, unstructured conversations, almost like just talking with a friend. They also connect with key informants, people in the community who have a really deep understanding of how things work. And sometimes they even look at personal things like diaries and photos to get an even richer sense of the world they're in.
Okay, I know what you might be thinking. This sounds a whole lot like anthropology, right? So how does any of this apply to the very practical, often very fast-paced world of nursing care?
Well, that very connection was made by a brilliant nursing theorist named Madeline Leininger. She actually coined the term ethno-nursing, and she put it perfectly. It's about observing and documenting how people's everyday lives and cultural patterns shape everything to do with health, care, and how they interact with nurses.
And this right here is where the rubber meets the road. This approach creates a direct line from a deep insight to a real-world impact. See, you start by truly understanding what a community believes about health. Then you can design care and interventions that actually make sense to them, that fit into their lives. And when you do that, you start to address health disparities, and you can even build smarter, more human-centered healthcare policies.
So what does this actually look like? Well, an ethno-nursing study might try to figure out why women in a certain community aren't using the maternal health care services that are available. Or maybe it'll explore the role of traditional healers in a tribal area so modern medicine can learn to work with them, not against them. It's about solving real problems.
Now, as powerful as this method is, it's definitely not a walk in the park. It comes with its own set of pretty significant challenges.
I mean, look at the trade-offs here. On one hand, the upsides are huge. A deep, rich understanding of a culture that helps you design truly sensitive care and tackle health disparities. But on the flip side, this work is incredibly time-consuming. There's always a risk that the researcher's own biases can creep in, there can be some really tricky ethical issues, and because the findings are so specific to one group, you can't always apply them broadly to everyone else. But here's the bottom line. Despite all those hurdles, the kind of deep cultural insight you get from ethnography, it's invaluable. You just can't get this stuff from a multiple-choice survey. And this kind of understanding is absolutely essential if we're serious about building a healthcare system that works better for everyone and is truly equitable. So I'll just leave you with this final thought.
If we agree that culture really is the lens through which every single one of us sees the world, and that includes every patient we meet, then are we really doing enough to see our patients clearly? Something to think about. Thanks so much for joining me.